Welcome to the Idea Exchange podcast. In today's episode, we will be talking more about anemia. I'm your host, Wes P, and our guest is
Dr. Lekan.
Welcome.
Thank you.
What is anemia?
Okay, so when you talk of anemia, it's a disease of blood. So it's a condition. World Health Organization defines it as reduction in hemoglobin in the blood. So they have their cutoff points. Hemoglobin of less than, for example, less than 13 in the males and less than 12 in the females. But let me explain when you talk of hemoglobin, what really this is. Hemoglobin is just a red pigment of blood, which is involved in carriage of oxygen throughout the body. So you and me, I think we did biology at secondary school, whereby we were learning about respiration, inspiration and expiration, movement of air inside and in and out of lungs. So when air goes in, it carries oxygen with it. So that air, for that oxygen to be transported through our body, it requires a carrier. So this carrier is hemoglobin. And where this hemoglobin is found, it is found on the surface of red blood cells. So there are sometimes conditions whereby someone is not able to have or is not having enough of that hemoglobin in blood. So that condition is what we call anemia in simple terms.
Right. What are the causes of anemia?
So there are so many causes, but I think I'll explain more when you get to the classification. So I think for that question, let's spare them. But maybe I can just broadly say we can classify the causes as either decrease the blood production, increase the blood loss, and increase the blood destruction. So I can just group the causes in that three categories. But we are going to explain more as we go on with our discussion, especially when we reach at classification.
What are the risk factors of anemia?
Okay, so risk factors for someone to develop anemia, there are so many. For example, someone who is poor, they are not taking enough iron, food rich in iron, or food which is rich in vitamin B12, they may have anemia. So, socioeconomic status of a person. The other risk factor is someone has your parents had certain traits which cause anemia. Sometimes you may be at risk of getting that trait into you, and you may develop anemia. For example, maybe your parents had sickle cell disease, and you may inherit it from your parents. And if you have sickle cell disease, you may develop anemia. So, family history of anemia. And the other, we're talking of the risk factor, right?
Yeah.
Yeah. The other risk factor is, let's say, you have contacted certain virus. There's a certain virus which we call parvo B virus, which affects your bone marrow. Okay, so it damages some of the cells in the bone marrow which are responsible for production of blood. So if you are affected with that virus, parvo B virus, you are at risk of developing anemia. The other risk factor for you to develop anemia is whereby you have a chronic disease. When you say chronic disease, it's a disease which has been there for a long time. For example, people with cancer, they are at risk of developing anemia. People with renal disease, people with liver disease, people with HIV, they are at risk of developing anemia. So the other people who are at risk of developing anemia are pregnant women because of increased demand. Because there are two people feeding on the same iron, which you usually get as a woman. So you may be anemic at times. The other people who are at risk of developing anemia are children, but it's a physiological thing. When you say physiological thing, it's a thing which we don't really worry about. It should happen as children are developing from childhood to adulthood. They need to lose their childhood hemoglobin to get adulthood hemoglobin. So in that process of losing, some of the hemoglobin is damaged. So when it's damaged, you measure their hemoglobin. It's fine. You can find it to be low. It doesn't necessarily that they are sick, but it's a normal thing which happens. Yeah. So basically, that's what I can say. They are the people who are at risk factors.
All right. What are the signs and symptoms of anemia?
Um, so people who are anemic, they are not always symptomatic. What I'm trying to say, they cannot always show signs and symptoms. Sometimes people can be moving around with anemia, but let's say people who are anemic, you want now for them to go to hospital. What are they? What can they show? Isn't it? That's what you're asking.
Yeah.
Yeah, sometimes they may have difficulties in breathing. So they may have shortness of breath. They are breathing with difficulties. Sometimes they may be weak. They cannot be able to do anything. Uh, Sometimes they may not be able to walk. Sometimes they may have chest pain on the chest. Sometimes they may have heart palpitations. They feel like their heart is running away from them. They feel like their heart is pumping very fast. That's heart palpitations. Sometimes they may have pale mucous membranes. So what are mucous membranes? So it's a membrane which covers our mouth. Okay, so when you open your mouth, you see something pink or reddish. That's a mucous membrane. So sometimes it becomes pale. I think for you girls, you know what colors very well. You know what pale is. So it becomes whitish like.
Yeah.
Yeah. So sometimes they may have, if they are children, they may have growth impairment. They may be short, because maybe of other kind of anemia which affect which we call them cerebrovascular anemia. Yeah, basically, uh, there are some more features which I cannot really say them here, but sometimes they may have hemorrhage. They're just bleeding everywhere, in the mouth. Yeah, they are just bleeding in the nose, through the nose. They're just bleeding. Yeah, sometimes they may have. Uh, Basically, let me stop there.
All right.
Yeah.
Now, how does anemia impact the quality of life?
Okay. I hope by now I have explained how hemoglobin is important in our bodies. I have said that hemoglobin carries oxygen from our lungs to the rest of the body for metabolism. Metabolism is just a condition whereby energy is being produced for our day-to-day functioning. Okay,
Yeah.
so we need hemoglobin to carry this oxygen from our lungs to our tissues, to our cells, whereby this oxygen combines with glucose. I hope you remember from your secondary school things. I'm not talking about things from heaven here, but it combines with glucose to form energy. So let's say you are in a condition whereby you don't have enough oxygen. It means you'll be short of energy. Okay,
Yeah.
so that's why people come with weakness. Yeah, heart palpitations because the heart pumps faster so that it compensates with the low hemoglobin or low oxygen which blood is carrying. So it is trying to pump faster, and hard so that maybe enough blood can reach to where it's supposed to reach. So basically, that's how it impacts someone's life. If it is too severe, someone can die. How can you live without energy? You can't, because even for your heart to function, you need energy. For your lungs to function properly, they need energy. Even for you to talk to me, for you to look at me like that, you need energy. So you cannot do anything if you're not energetic enough. So yeah, basically.
All right. How do you classify anemia?
Okay, so classification of anemia is through different ways, but one way we classify anemia is through we call it cell size.
Mm.
Okay, so cell size is as simple as how much um, how much blood how much blood is in, or how much what the size of the red blood cells themselves. So we can classify them as microcytic, nomocytic, and macrocytic. What am I trying to say? We have cutoff points. When we do our full blood count, when we take samples and we do full blood count, we check where we have mean cell volume, MCV. So let's say MCV is less than around 69, we call it microcytic anemia. Around 69 to 79 there, we call it nomocytic anemia. From around 79 to 80, I mean from 80 to 100 there, we have macrocytic anemia. There are processes that happen for us to classify it this way, and there are causes for specific category. For example, let's say people who have microcytic anemia, what are some of the causes? So, for example, people who lack iron in their blood, people with sickle cell disease, people who have a sideroblastic anemia, whereby maybe they have been affected by parvo B virus in their bone marrow. It disrupts production of blood cells. So those people get microcytic anemia. Even people who have lead poisoning, lead, metals. So when you go to periodic table, you see a metal which is known as lead poisoning. So those people also get microcytic anemia. People who get nomocytic anemia are those people who have chronic diseases. So I have explained about cancer, HIV, renal disease, uh, kidney, liver disease. These people are at risk of developing, and even those people who have just lost blood, maybe they have cut themselves somewhere or through operation, they lose blood. These also people are at a risk of developing nomocytic anemia. People who develop macrocytic anemia are these people who lack either vitamin B12 or folate in their blood. So these people have nomocytic anemia. That's one way of classifying it. The other way we classify anemia is through the cause. Okay? So sometimes anemia can be caused, as I explained at the very beginning, anemia can be caused by either reduced the blood production, increased the blood loss, and increase the blood destruction. So it's either your body is not producing enough blood, okay? Yeah. That's classification according to the cause. It can be anemia is caused by your body is not producing enough blood, or it can be your body is destroying blood, a lot of blood, or it can be you have lost blood. So these three, we can also classify anemia through that way. I think that's enough.
All right. How do you investigate anemia?
Okay, so there are so many ways we can do to investigate for anemia, but basically we investigate anemia to identify the specific cause. Because when we identify the specific cause of a thing, you can easily manage it, isn't it?
Yeah.
Yeah. So we do investigations to identify what is causing it. For example, um, maybe anemia can also be caused by, for example, I on the anemia of chronic disease, I forgot to mention malaria, but it's also there. Even bilharzia, people who have bilharzia, those people who urinate blood, yeah, or people who have ulcers. For example, we want to identify the cause of anemia. Before we go deep into sophisticated investigations, we do simple things. We test someone for malaria. I mean for malaria, and we find them they are malaria positive. Maybe anemia was caused by destruction of red blood cells through malaria. The parasite itself was destroying blood cells. If we find that the person is having malaria, we treat malaria. They are okay. They go home. Sometimes they are caused maybe by bilharzia. Where does bilharzia come from? Maybe in feces. It's in feces. We take feces, and if we find some of the eggs for bilharzia there, we treat for bilharzia. Okay. Yeah. Sometimes what can it cause? Sometimes we take blood samples to test for how much hemoglobin do you have. So we do FBs, full blood count, to check if you have enough hemoglobin or not. And also full blood count is the one which helps us to classify anemia as either microcytic, macrocytic, or normocytic, depending on those figures which I mentioned. Yeah. Sometimes we take blood to do renal function test. Okay. Sometimes some of the blood is destroyed through kidneys. So we also do renal function test, because if we find that kidneys are not functioning properly, we treat for the cause. Sometimes we do HIV test. People who are HIV positive, I say that they are at risk of developing anemia. So we do that. If it's a woman or a girl who is in reproductive age like you, we test you for pregnancy. Maybe you are coming to us because your pregnancy, your child is just eating your iron, and then you have developed anemia. We check for pregnancy. If we find that you are pregnant, we won't worry enough, because we know where the anemia is coming from. Sometimes I said anemia can also be caused by um, okay. I said anemia can also be caused by what? Um, I was explaining about pregnancy, right?
Yeah.
So we test for that. I said the anemia can also be caused by iron deficiency. There are iron studies which we do to identify whether this anemia is coming from um, anemia or not. Sometimes we ask you if there's someone who had sickle cell disease in your family, you may also have sickle cell disease. So we also test for sickle cell disease. We find that you are sickle cell positive, then we know how best we can help you. Sometimes we do bone marrow. I hope I explained this sometime that there is parvo B virus which affect your bone marrow, and it disturbs the production of red blood cells. So we take bone marrow sample, and we go to test for that virus. If we find it, we easily treat it. So Sometimes I also explained that microcytic anemia is caused by lead poisoning. I hope you remember what I'm saying. Sometimes it's caused by lead poisoning. We also test blood for presence of lead particles. So basically, that's how we test for. Sometimes we can also do vitamin B12 levels, but we don't really do in our setting because of lack of resources. Basically, yeah. That's. Thank you.
What are the treatments of anemia?
Okay, so we treat anemia sometimes depending on how the patient has presented. Let's say their hemoglobin is less than 5. These people are at risk of developing a lot of complications for anemia, or they cannot easily survive uh, with that level of hemoglobin. So these people, we put them on of course, we need to put them on oxygen because they're having difficulties in breathing, right?
Yeah.
Yeah, but sometimes we need to give them blood. Yeah, so there are so many blood products which you can give the patient, but we give the blood depending on how much we want their hemoglobin level to be. Sometimes, if they are not, if their hemoglobin is more than 5, and they are not really symptomatic, we give them medication. So we have ferrous sulfate. It's a medication which we give patients to be taking every day for at least 3 to 6 months. We check their blood hemoglobin after a month to see if at all it has improved. But basically, in most patients, it does improve. If it doesn't, we investigate for other causes. Maybe they are still bleeding somewhere, even though they are taking these tablets. Maybe they are bleeding somewhere, maybe inside their stomach or inside their intestines. We test for the same to make sure that we don't miss everything.
All right. What are the prognosis of anemia?
Okay, so prognosis of anemia basically depends on how best have you identified the cause itself. Like I said, there are so many causes of anemia. Of course, I cannot mention everything here. So, we prognosis of anemia depends on you identifying a cause. Okay,
Yeah.
because even on the management depends on the cause. I have just mentioned a few on how you can manage it. For example, a patient is having cancer. I mean, you need to do operation to remove that cancer, isn't it?
Yeah.
Yes. So a patient has come with vitamin B12 anemia. You need to supplement vitamin B12, isn't it?
Mm.
Yes. So basically, you treat anemia depending on the cause. Even the prognosis of anemia sometimes it depends on whether you have identified the cause in good time and you have dealt with that cause in good time. Patient, let's say patient has anemia due to cancer and you haven't identified that cancer in a good time. A patient is going to die despite how much blood you are giving them, despite how much which medications are you giving them, or for how long. So they will still die. But let's say you have identified area that maybe this patient has a cancer in her stomach or in her intestines. Okay,
Yeah.
or you can easily, and that cancer hasn't spread enough to other parts. You can easily remove that cancer. Then you do operation, you remove the cancer, you have reduced the bleeding, so the patient is going to live. So a patient is bleeding through ulcers, simple ulcers. You know ulcers, right?
Mm.
Yes. This patient is bleeding through ulcers, and you haven't identified that the patient has ulcers, has been complaining about abdominal pain, but you don't care. What you care is just anemia. The patient will still die from blood loss through ulcers. So you need to investigate properly to find whether the patient has ulcers or not. But let's say you have identified the cause in good time, a patient is going to live their happy life, and the hemoglobin is going to go back to normal levels, and they are going to breathe properly without having much difficulties. Yeah, but maybe I can just add these ones. Let's say a patient has come to the hospital with anemia, or is at home with anemia. What are other things which you can easily see? Okay, sometimes you can find that the person is sitting or standing in an abnormal position. They were working properly, but maybe because of weakness, maybe they are not able to stand still or on one side, or maybe they lean on one side because they are weak. Sometimes they cannot walk. Sometimes they have abdominal distension. Maybe the anemia has affected even the liver itself. Okay, so or maybe the liver has been affected by cancer or TB. They may have abdominal distension. You can easily notice those. You need to send these people to hospital. Okay. Sometimes when you look at their fingers, they may have spoon like fingers, so they are curved. Okay. You can easily notice those. Sometimes they have whitish fingernails. You know, mine are, I think they are pink, but sometimes you may find that they are white throughout. You may notice those ones easily. I forgot to say about the how does it impact quality of life. Some people may have heart failure because, like I said, they may have heart palpitations. So the heart is pumping so fast and so fast and so hard to make sure that the little oxygen which the blood has carried is reaching throughout your body. So if the heart is pumping as fast and as hard as that, it may fail sometimes. It may get tired. So a patient may present with heart failure. Sure.
All right. Thanks for your time.
All right. Thank you so much.